Also something that we will mention now with laser and safety, safety first. You know that we are using this kind of laser actually, three different technology. Which laser is the best? I don't know. I know which one is the best for the dusting. Some other are better for fragmentation. We cannot do everything at the best with only one laser today. Okay, so in the ideal world, it would be nice to have the three and to select according to what you are doing. A bit tricky, but it's like this. All of them are pulsed, so it means they are not continuous. When you press the pedal, you generate pulses. So you know this formula. Keep in mind this formula, but also keep in mind that frequency is not what you need to set first. This is the less important parameter. What is important? Total power. You need to respect some limit. You cannot use the full power. It's impossible. I'm talking about endourology for stones. I'm not talking about prostate. And energy, because at the end, energy is doing the job. So if you put some limit in terms of power, and I will give you the limit that we recommend today, if you fix some energy, you are limited in terms of frequency. So when you are asking people, what is the best setting for dusting? Most of the people say, I put high frequency, and no. You can produce fantastic dust with low frequency. Very important to know. We know this, pulse duration, peak power. If you increase the energy, and if you select a short pulse, you increase the peak power, and you will obtain a fragmentation effect. The opposite, if you use less energy, and if you combine with a long pulse together, you decrease the peak power, and now you are producing dusting. This is dusting. Dusting is not high frequency, to be very clear. Frequency, to do what? To regulate the speed. You are in good condition, you would like to go faster, put more pulses, and then you will go faster. If you are not in good condition, you need to be precise. Into the ureter, for example, you need to control all the shots one by one, not on the mucosa, put low frequency. But frequency doesn't change the quality of the dust. You need to accept that. You maybe know this publication from Dr. Eugenio Ventimiglia, fantastic one. It was the most cited paper in 2023, and he was awarded at the AUA for that. What he demonstrates, low power versus high power, no difference. In terms of flexible ureteroscopy, I'm not talking about PCNA. Regarding thulium fiber, what do we know? In the lab, when we do lab experiment, thulium fiber is all the time superior, all aspects. It goes faster, it goes finer, we have less retropulsion, we damage much less the surgical fiber. But that's the lab. In the real life, it's not exactly the same. Even the Nordic colleagues, it's a great publication, they demonstrate in a randomized prospective evaluation, thulium fiber was superior. They said better central rate, it was going a little bit faster and less complication. But if you ask the American colleagues, they did a similar and they said no difference, exactly the same. So still controversial. Presetting, what is the best setting in terms of dusting, fragmentation, popcorning? You ask the laser companies what they recommend. You look, no consensus. You talk about thulium fiber. You ask all the experts, or people supposed to be experts. What are you using? What is your preferred setting? If you look, no consensus. Why? Just because setting is very personal. It depends on you. It's not the only parameter for laser efficiency. It depends if you are moving fast, if you are taking more distance, less distance, quality of view, irrigation, etc. So it's very difficult to give you a fixed setting. So laser and safety. Safety for the surgeon. Is it dangerous for you? That's another Italian colleague, Dr. Luca Villa. When he was a fellow with me, he was shot with the laser. You probably know this kind of problem. But look, after 3 months, disappear. After 8 years, completely fine. So it means it's not a good moment, but it's not a big deal. For your eyes, if you come back to this publication, original one for holmium technology, Johnson said, no need to use laser glasses. But you know, and we confirm that, again with Dr. Villa, he demonstrates the risk is super minimal, almost zero. So the laser glasses we don't really need. That's what we need. Glasses to be protect for X-ray, much more dangerous. And those glasses, they also protect against laser for a few seconds. So use this one. Now for the patient, look at that. You know this kind of picture. What does it mean? Ureteral stenosis, why? People maybe will say, it was impacted. Okay, maybe. It can probably participate. But what is strange, if we ask the people doing a lot of endo, since few years, all of us, we said, we see more and more ureteral stenosis. Does it mean that we have more and more stone impacted? Probably not. Laser is the problem. Remember that when you increase the power, and you know that for sometimes many people, many companies were pushing for high power, high frequency regime for stones. If you put more power, that's because you are putting more frequency. You cannot generate 30 watts because of energy. Because energy, you are using what? 0.3, 0.5, maybe 1 joule, maybe 1.2. With 1.2, you cannot reach 30 watts. So if you are using more power, that's because you are pushing the frequency, thinking that frequency is better. So when you do this, if you increase the power too much, 30, 40, 60 watts with that, that's what you create in a small space. You boil, and hot water burns. If you put hot water on your skin, you are burned. It's not the laser who damage directly, it's just because the water is super hot. So by using more power, be careful because you generate more hot water. And hot water can coagulate the tissue. The second problem with too much power, so too much frequency, it means many pulses per second that you cannot control. If you are in a narrow space, like the ureter, sometimes you shot beside the stone. If you are not on the stone, you are not into the water. You are against the mucosa. So now it's a direct damage of the laser. So think about thermal damage means two things. You generate hot water, can damage the parenchyma, the tissue, and you also generate direct impact on the tissue. Pseudoaneurysm. Recently, people said with thulium fiber, we generate pseudoaneurysm into the kidney, and we were forced to embolize. Okay, with thulium fiber. But if you look at the literature, there's already 7 cases already described with pseudoaneurysm with embolization. And if you look, more cases with holmium yak than thulium fiber. So exactly the same problem with holmium yak. So it's not the problem of thulium. The problem is exactly the same. And if you look at these cases, what's the problem? Look at the power. Too much power. And too much power, why? Because too much frequency. It goes together. And all the cases are like this. Your colleague, Dr. Alba, Sierra del Rio, that you know very well, from Barcelona, she did 2 fantastic papers. This one, she was looking for the thermal damage into the ureter for junior residents and also for senior, using thulium fiber. What she demonstrates, much more damage into the ureter if you are using more frequency. It was not dependent of the level of energy. It was dependent of the level of frequency. And it was even more for the junior, the residents compared to the senior. Of course, it's a question of skills, technique. She did a second great paper. For the same total power, she was evaluating 2 techniques, what we call the continuous one. It means that you press the pedal continuously and you have regularly the pulses, constant. Or what we call the burst. Burst means that for a few seconds, you have plenty of pulses, then you stop, then plenty of pulses, then you stop. That's what we call the burst. If you take exactly the same number of pulses per minute, but you do these two distribution, much more dangerous to use the burst. So it's much better to use low frequency and to go continuously because you control most of the pulses like that. Who is responsible, actually, for this damage? Of course, you as a surgeon, because you are responsible for the settings. So if you decide to take too much, you have to accept and to be responsible for that. And look at this colleague. He sent me a case, and he said, I don't understand. I did with low power, 12 watts, but I generate this. Why? Look at the report. He was using 12 watts, low power. It's okay into the ureter, but look at the settings, 120 hertz. 120 pulses per second. Who can control? Nobody. So he was losing a lot of pulses, and he damaged the ureter. Company also responsible. If you see this kind of a setting, that's pre-setting. It means that you are coming with the system, you press the button for ultra dusting, and that's what you get. 50 millijoule, it doesn't work. It's not enough in terms of clinical practice. You have a mid pulse, you see? It's not a short pulse, it's a mid one. Super low peak power. It doesn't work to break stones, but it damages the tissue. And 400 hertz, terrible. Never use this kind of setting. You will have plenty of problems. And it's already the case. You know, there is official declaration actually in Canada, 28 patients with full, complete ureteral stenosis, completely blocked, 28 cases. That's terrible because of the setting. And of course, some key opinion leader. You know, when we are on stage, we are not on stage to say, I'm the best of the world. Nobody cares. We are on stage to give safe message. So when you see some key opinion leader giving this kind of recommendation, for me, it's a big mistake. You cannot recommend to use 0.2, 160 hertz or 150, 300. It's terrible. Look at the power, 45, 36, 42. It's too much. Maybe it's okay for this guy because he's good, but he cannot recommend that. So now just to conclude and to understand this problem of thermal damage. If you consider that the collecting system is more or less 10 to 20 because we expand a little bit when we irrigate. So let's consider that. Also, remember that. Protein and coagulation, 60. If you go to 40, you generate what we call the denaturation of the protein. But if you stop, it's coming back. Very important. You need also to remember that 1 calorie increase 1 milliliter by 1 degree. That's the definition. What is 1 calorie? 4.2. So to make more simple the calculation, let's say 4 joules. 1 calorie, 4 joules. Increase 1 milliliter by 1 degree. So if you want to go to 20 to 21 degree, if the kidney is 10 milliliter, you need 42 joules. You generate 42 joules, you take 1 degree in the collecting system. The kidney is bigger, you need more energy, of course. Let's put the limit to 40, because we know that if we don't go more than 40 degrees, we will not coagulate the protein. So let's say that 40 degrees is the limit that we accept. 10 milliliter, you need 840. And again, for the different volume, if you are lucky with a big kidney, you know, you need, of course, more energy. If you consider a regular setting, that's what I was using today, 0.615. If you use this, you generate 9 joules per second. So to reach 840 joules, 1.5 minutes. If you have 1.5 minutes with this setting, you increase the kidney from 20 to 40. But of course, it doesn't work like that because we are using irrigation. We have inflow, outflow. So we refresh the system. We cool the system because we irrigate. Problem is, if we increase too much the inflow to have a lot of cold saline, what's the problem? Pressure. So we cannot force too much. We have to accept some compromise. So if we look, what can we generate in general? What is the flow that we generate in a regular case? We have plenty of evaluation on that from the lab. 20 milliliter per minute. That's what you generate in general. You can accept that, okay? So if you consider that you have 20 milliliter of fluid to refresh the system, no more. If you respect 40 degrees, the kidney is 10 milliliter, you are using 0.615, you generate 9 watts, so it means 840 per minute. You need 90 seconds to refresh. And you need to produce 7 milliliter per minute. So if you produce 20, you are safe. So this setting is safe because you will not reach this limit of 20 milliliter. If you increase the frequency, you keep the same energy, but you increase frequency by the double, 18 watts. Now you need flow 14, close to 20. Maybe still safe, but be careful. If you increase to 45 hertz, now you need 21. Now you start to be in trouble. And of course, if you go even more, 60 hertz, then you need 88. So at the end, if you consider that you generate 20, what is safe? Super low settings. Maybe 0.630. Of course, if the kidney is bigger, 15 or 20, okay, you have more space, no more possibility. The problem is that you never know exactly the volume of the kidney, so you need to consider the minimum. And the minimum, if you consider 10, that's what you need to respect. So at the end, it's a compromise to give the good setting. We cannot push the system at the max, unfortunately. We would like. So if you consider the pielocalicial system is this, to respect less than 40 with an irrigation of 20, you need into the kidney to respect less than 20 watts, less, according to the settings that you prefer, but less than 20 watts, no more. And you know what is funny? If you look at publications, we already know that since many years. If you look at this publication, it's an excellent one from the American colleagues. They did a lot of experiments. Look, using this kind of setting, 0.510, 110, they calculate the temperature they generate. No flow, they said you can reach 41, 44, 42, it's dangerous. But if you have a little bit of flow, 7, 14, 30, it's safe. You cannot reach high temperature. So those settings are safe if you have a minimal flow. If you increase the parameter, now you are not safe. To be safe, you need to generate 40 milliliter per minute. It's impossible because the outflow is not enough. What is funny, this team, they did this fantastic publication, but when you listen to this guy talking about settings, they promote high power, high frequency. So for me, it's something I cannot understand. And of course, if you keep the laser on with more time, it's even worse, because time is also an issue. So to respect this, again, less than 20 watts. It's coming from this publication. Look also what the American colleagues, they changed completely their mind, actually. Before it was high power, high frequency. Now look what they recommend. Dr. Glenn Preminger, one of the top in the world, 0.812. That's what he recommends. He said that's the preferred setting. I love this publication. It's a great one. Again, the Nordic colleagues, they do a good job. They did an evaluation in vivo. They record the temperature into the kidney with a nephrostomy tube to see what happened. It's a bit complicated. What is the conclusion? Less than 20 watts. And if you look, another publication from Dr. Ventimiglia from Milano, fantastic publication, recently published. Look at the conclusions. Kidney, less than 20. Ureter, less than 10. This is a great recommendation. So to summarize, less than 20 watts into the kidney, less than 10 in the ureter, and it's even more into the ureter. It's not only less than 10, it's less than 10 watts, but it's also and low frequency, meaning less than 15 hertz, maybe less than 10. Go slow into the ureter, not to touch the mucosa. So what is the solution? What can we do to improve this? Today, nothing. You just have to respect what I'm telling you. Less than 20, less than 10, and low frequency for the ureter. But soon, those kind of system is coming, suction. And when suction will come, we will control the pressure, we will control the temperature. And when we will have good suction system, now we will be able to increase the power. Remember that frequency is not important. And just to summarize what you can do at the different level, kidney, ureter, and bladder. Thank you.